Well, hello everyone, and welcome to today's Heart Talks webinar. I'm Celina Gorre, and I'm the CEO of WomenHeart. For those of you who are new to WomenHeart, we are an organization committed to providing education, support, and advocacy for women living with and at risk for heart disease. For over 25 years now, we have been working to ensure that women have the accurate information and resources that they need to navigate their heart health. Our topic today is the role of nutrition and lifestyle in supporting cardiovascular, kidney, and metabolic health. We are especially excited to be having this important conversation just at the tail end of National Nutrition Month. And it also happens to be Women's History Month. So we're kind of, doing two things at once. Before we get started, I really want to thank our sponsors for supporting this webinar. The Boehringer Ingelheim and Lilly Alliance and Roche Diagnostics are supporting this work, which really allows us to increase awareness and education around cardiorenal metabolic health. And we're so grateful for their partnership. So now I am so thrilled to be joined today by two amazing guests. First, we're going to hear from Colleen Dawkins, who is a nurse practitioner and registered dietitian. It's a really powerhouse combination. She's got some deep experience in obesity, nutrition, and chronic disease management. And I know many folks on this call are going to really appreciate her insights. And then later in the program, we're going to be joined by Rosie Harrison, a heart sister, a WomenHeart champion of class of 2024 from Georgia, who will share her personal journey and how nutrition has played a key role in her heart health. So today we're focusing on a topic that's become increasingly important, broadly important, but specifically in the cardiology community, it's also really taken hold and gone to scale. Cardiovascular Kidney Metabolic Syndrome, also known as CKM syndrome. So this refers to the interconnected relationship between heart disease, kidney disease, and metabolic conditions like diabetes and obesity. It's interesting. We were speaking before we started this session about how in the public health world, we've been talking about this interconnectedness for a long time. And really now it feels like the medical community, and in particular, the cardiovascular community has really embraced, right, this approach, an approach that I think those of us living with heart disease, living with diabetes, living with obesity have known for years, right, through our own lived experience. Many of us are familiar with these conditions separately, but we often don't talk about how closely they are related and interconnected with one another. So managing them requires really a comprehensive approach that includes lifestyle changes, self-advocacy, support, and collaboration with your medical team, and a whole host of other things that we're going to talk about today. So one of the biggest factors that can help manage CKM syndrome is nutrition, as we've already said, which is why we are so excited to be having this conversation and doing really a deep dive with an expert, as well as somebody who's going to share their lived experience. And hopefully this will inform your thinking about your own life and your own nutrition and your own management of these various conditions. So let me introduce our first speaker. Colleen Dawkins is a nurse practitioner and registered dietitian with a deep understanding of obesity and weight management. She's board certified in family medicine. She is a certified specialist in obesity and weight management, and she holds an advanced certification in obesity medicine. She's also an associate editor of the Obesity Pillars Journal and serves on multiple advisory boards focused on nutrition and metabolic health. With her expertise in both medicine and nutrition, Colleen brings a really unique perspective on how dietary and lifestyle choices can impact CKM syndrome. So welcome, Colleen. And I'm going to turn it over to you.
Okay, great. Thank you for having me, Celina. And I think the first thing that we need to talk about is what CKM syndrome actually is. So, cardiovascular kidney metabolic syndrome. It's a relatively new term, and it definitely concerns our heart, kidneys, and how our body uses energy, the food that we eat, and that's the metabolism part. And I think that we know heart and we know kidneys, but sometimes metabolism can be a little bit more confusing. So, when you think about metabolism, think about how our body regulates blood sugars, how we store energy as adipose or fat tissue, and our immune function, things like that. And just keeping in mind that those do all start to inform one another. And I think the other thing that we want to talk about is what syndrome means. So, because it can, be a little bit confusing between disease and syndrome. And what syndrome is a group of symptoms that occur together in a condition. So, in this particular one, we see that there's symptoms and diagnoses of heart disease and kidney disease and metabolic disorder that come together to form this syndrome. And each of these informs essentially how our blood flows through our body and how that impacts organ function. So if our blood's not flowing very well, our organs aren't going to function very well, and those all play together. So think about maybe you've injured your ankle, and so you start to walk a little differently, and now the hip on the other side starts to hurt, and then maybe the knee also starts to hurt because those things all work together. And so if something's not functioning well, it's going to start to have a cascade effect through other parts of our body.
Um, I'd love for you, Colleen, to talk a little bit more about specifically about sort of the interconnectedness. I know you talked about sort of the syndrome being this group of related symptoms, um, and can start to talk a little bit about what that means as it relates to our hearts, as it relates to our lungs, all of the different sort of moving parts in the syndrome.
Sure. So, one of the things that underlies all of this is inflammation, and this can be at different levels throughout the body, too. And so, we see that throughout the body, inflammation starts to impact how everything's functioning and working together. So, inflammation informs something like how our body uses glucose and sugar, for example, carbohydrates. So we might find that we have an increase in insulin resistance, meaning that our cells don't recognize and use insulin the way that they should. So our blood sugar stays higher. So that actually worsens inflammation and weakens our blood vessels. Blood pressure is another thing that can happen. So high blood pressure means that, again, your vessels are getting stretched more than we'd like them to and getting more pressure. So they're weakening and it's making the heart work harder. And so now we start to see that, okay, all of our blood vessels and arteries and everything are stressed, and blood flow again becomes a concern and an issue. And so now we have high blood pressure, we might have elevated blood sugars. And then there's the high cholesterol aspect of this from heart disease. And I know we've all heard a lot about fat and cholesterol, and even going back to the 80s where fat was very bad, and now we realize that that's not really the case. It's just certain types of fat are not as healthy. And so we start to see where all of this plays together to complicate things, even things like lung and brain function and blood flow to our toes, that kind of stuff.
Yeah, I'm really happy that you brought up inflammation. I mean, I think it's sort of like you said, this overarching issue that really kind of is the starting point and often the ending point for so many of the things that we're talking about here. If we go to the next slide, my question to you then is, why should women in particular be particularly concerned about CKM syndrome?
Yeah, so this is a great question. And I think starting out with knowing that women may not be diagnosed and treated as quickly when it comes to things like excess weight, insulin resistance, high blood pressure, high cholesterol, and that increases our risk for developing CKM syndrome. So one of the things that informs this is our change in hormones. And so, for example, in perimenopause and menopause, we start to have a decrease in estrogen. Estrogen is heart protective. So if we're losing that protection, we're increasing our risk, right? And if we have a history of things like PCOS or polycystic ovarian syndrome or infertility, there's also inflammation, there's insulin resistance that's coupled with those. So that also increases our risk. And other things inform that, including, how we live our life. Are we moving enough? What are we eating? How's our stress level? How's our sleep? And what's our mental health doing? Because all of these things impact our heart health. And so, another concern that we have is that women don't always put themselves first. They're
Yeah.
often taking care of a lot of other people, doing a lot of other things, so they don't make their own health a priority. Another thing that I see happen is that women might avoid going to a healthcare professional because they've either had a bad experience in the past or felt judged or was told that whatever it was all related to their weight and not listened to, essentially, right? So we get conditioned to, well, you're not going to listen to me, I'm not going to talk to you. And so they just don't go to providers and get the kind of preventative care that we really need. So there's a lot of things that inform that increase in risk, especially for women.
I just wanted to interject here of an experience I just had. So I had been pre-diabetic for years, and I thought I'm cool, pre-diabetic. Like I'm not diabetic. I don't, I'm not diabetic. And this is the first time that my cardiologist said, no, we need to treat your pre-diabetes. And I
Mhm.
said, what do you mean? I thought I'm kind of safe, right? I'm not in the diabetes zone, the diabetic zone. I'm in the
Yeah.
pre-diabetic zone. And it was really an eye opener when she said, no, that means all this time it has been impacting, right? Impacting your cells, impacting, sorry, your blood vessels,
Mhm.
in exactly the way that you've talked about. So just talk a little bit about that when you see patients who are pre-diabetic, what are the conversations that you have with them?
Yeah, so we had understood before from healthcare providers that prediabetes wasn't a big deal because it wasn't diabetes, right?
Yeah.
So, and there used to be kind of the conversation of, well, there's diabetic and there's not diabetic, just like there's pregnant and there's not pregnant. There's
Yeah.
not an in between. And it turns out there is an in between where our cells stop recognizing and using that insulin much earlier than when it becomes diagnostically type 2 diabetes.
Okay.
And there's a lot that we can do in that meantime to turn that prediabetes around
Okay.
and go back to what we call normoglycemia or a normal blood sugar level so that we're not seeing that damage because it's a slow burn with that inflammation and prediabetes.
Yeah.
There's still a lot of damage that's occurring. It's just over many years. And so anything that we can do to reverse that and protect ourselves,
Yeah.
the better, definitely.
Thank you for that. And how would someone know if they have CKM syndrome? Are there specific symptoms they should be looking out for, or are there some tests that would help them to determine whether or not they have CKM syndrome?
Great question. So the symptoms, especially early, can be pretty vague for people. So something like poor sleep and headaches and low energy levels. You might even have shortness of breath with physical activity. And of course, those things can worsen the more heart involvement and kidney involvement that we see. So the less well that those are working, the more symptoms we're going to have. And again, it can happen so gradually that we might not even notice it. Oftentimes, when I'm working with somebody and we see an improvement in things like blood sugars and blood pressure, they'll say like, "Wow, I have more energy. I'm sleeping better. I have fewer headaches. I didn't even realize those things were impacting me." And so, again, we're not paying that close of attention sometimes to ourselves, and so we don't realize that we no longer feel as good as we did once upon a time, or we play it off as age, and that's not
Yeah.
always the case. So, if you have a risk for or have high blood pressure, high cholesterol, high blood sugars, perimenopause or menopause. All of those things can be diagnosed with different tests, like taking your blood pressure and taking a blood sugar. And so lots of lab tests can point us in the direction of is CKM an issue for you or not? Or are we in the pre-stages or stage 0, stage 1, those kinds of things?
I mean, it really strikes me that what you're talking about is essentially what we often say, which is that 80% of heart disease, or in this case, CKM, is preventable, right? It's a slow burn. And so there are multiple chances to intervene, right?
Mhm.
And if we, but we have to recognize it as a modifiable risk rather than thinking, I'm just tired, or I've just got so much on my plate. This is just my life, right? Being tired all the time is just my life because I'm taking care of everybody else. So I really, I'm hoping what we can do in this conversation is reframe that narrative to be like, no, we as women should not accept as normal that we're tired all the time, or that our sleep is poor, or that, we somehow are craving sugar all the time, or, like all the different things that you sort of go, huh, maybe that's just a fact of life, rather than, that might be a sign that I need to go and talk to a provider.
Yeah, and I see Rosie shaking her head as you were
Yeah.
speaking that, yeah, I mean, I can't tell you how many women come to see me, and those are exactly the things that they're saying. Like, well, I think this is just how my life is. I'm just tired. And there's a lot of reasons for that. Like, maybe, but what if we could make you less tired
Yeah.
and have a little more energy and do those things? And we can do that with medications, maybe, but definitely through lifestyle. So moving the body more and really paying attention to what we're eating. And sometimes that can feel overwhelming. So we talk about, well, what's the best thing to eat? And the thing that's the best is the thing that you can be consistent with. What you can be consistent, not me, but what you can
Yeah.
be consistent with. So, research studies indicate that the Mediterranean lifestyle is really good for our health in a lot of different ways. And so, do we need to follow that perfectly? Nope, not at all. Can we make some little changes like moving our body more, or having a little less salt, or just not adding salt to our food that we're cooking at home? There's a lot of little things that we can do to start to get more into a Mediterranean lifestyle and heart healthy lifestyle.
Can we go to the next slide? Yeah, that sort of starts to answer this question about all the different conflicting things we hear. And we have a good list here of the way you can approach a Mediterranean lifestyle, right? And it's not all or nothing. It is
Right.
tweaking at the margins for the things that you can do consistently. Not everyone has access to a farmer's market, or a place where you can get fresh vegetable. I'll tell you, I use frozen spinach every day in what I cook, right? And frozen stuff is perfectly good.
It
Um,
is.
and other folks might say, what really worked for me is keto, or what really worked for me is intermittent fasting. Or how do you like what do you do when you are confronted with those questions, or when your patients come to you and say, my best friend's, daughter, is doing this thing. Should I try that? What's your approach to that?
So, the first thing that I want to know is why it's appealing to that person. So, you've come to me to talk about this, but I want to know why you think that's good for you. Tell me what about it is attractive to you. Is it, that it kind of helps you with a hard reset on your nutrition? Or is, there something else that you think would benefit you? And for most cases, whether that's our health or weight loss or whatever it is, controlling blood sugars, the changes that we make to get to where we want to be health goal wise are things that we have to continue doing.
Yeah.
So, can you continue doing keto long term, not 6 weeks? Like we might be able to do something of a, reset from a nutrition standpoint and get into some better habits. But when we're looking at what we can do lifelong, you might not feel that keto is something you can do lifelong. So let's really look at that. And then also going back to, I called it Mediterranean lifestyle, not diet. We want to get out of that diet mindset because that very much tells me that this is a short-term thing, whether that's 5 days or 5 weeks or whatever it is. I don't intend to do that long term. A
Yeah,
lifestyle we can do long term.
absolutely. On the next slide, I know, we can start talking about, I know we don't want to use the word diet, but we can start talking about nutrition and what we're eating. And I know there's a lot of confusion about that. Do you go low carb? Do you go high protein? I know as a woman in my 50s, I am whether it's my doctor or my friends say, you really got to focus on muscle building, and therefore protein intake is really your priority. But then
Mhm.
obviously you've got to deal now with, fats and fats coming from animal products. So how do you kind of help your patients navigate through that confusion around carbohydrates, fats, and proteins?
So, I think recognizing first that it's going to be very individual for each person, and it depends on your health status, your kidney status. A lot of things like that inform how I'm going to work with you on carbohydrates, fats, and protein. In general, we do see that women, especially 50s and older, need to increase their protein, but there's some better ways to do that, and recognizing that things like bacon is considered a fat, not a protein. Uh,
Mm,
you know, so it's looking at foods a little bit differently, and where we can get some plant-based protein in addition to animal protein and really balancing that. And I think that's the other thing that we want to talk about is not only individualizing, but striking a nice balance. There shouldn't be this, all of this and none of this. We really want to move away from that. Making sure that we're getting a variety. Most of us can get more fiber. I think the last stat I saw was 97% of US adults do not get enough fiber. And enough fiber would be about 25 grams a day for women and at least 30 for men. So we know that we're not hitting those goals very consistently. So when we talk about, lowering carbohydrates, we want to lower carbohydrates that are higher in sugar. So the refined products, not necessarily fruits and vegetables and whole grains. We want to keep that in mind as well. So there's a room for reduction of some things, and then there's room for increasing other things, but it doesn't have to be one end of the spectrum or the other. It can be a balance.
yeah. And as you said, the most important thing is consistency and what you
Yeah.
can do for the long term.
Yeah.
Um, on the next slide, I know we've got some common mistakes that women make
Mhm.
when thinking about eating healthier for your heart and metabolic health. How do you, again, sort of address these things? I'll let the audience and let you all read what we've got here. Um, I guess these are myths that you try to debunk. Yes.
It is, yeah. And so you said what were the mistakes that women make? And I think one of the mistakes that we make is buying into hype, essentially. So thinking that CKM syndrome doesn't affect women, it definitely does. Thinking that there's not anything we can do to prevent it, but we can. And that we have to do everything perfectly, from eating perfectly to physical activity and sleep and stress management, all of the things perfectly. We do not have to do anything perfectly anywhere in your life, just to be clear, but particularly here, because even small changes make a difference. So the other thing is hearing things like all fat is bad for you. And that's
Mm,
something that just persists for
yeah.
some reason. I'm not really sure why that is, but let's move away from labeling things good and bad, especially food. And I see Rosie is nodding her head in agreement with that as well. But that black and white thinking, it's this or this, when really there's middle ground in so many things, and we need to have that space for that middle ground and really moving away from it's all this or all that.
That's great. It's really sort of great direction. And speaking about all this or all that, when as heart patients, on the next slide, we do often talk about sodium, right? Salt. We you mentioned fiber, which is really important to increase, I know, and then we talk about healthy fats. I'd love you to go in a little bit more deeper on each of these three. And I'm particularly curious about the sodium piece, because
Mhm.
sometimes even when you avoid that table salt, you are still eating a lot of sodium.
Yeah, such a good point too. And so, how does sodium impact our body? Well, first of all, we do need some sodium or salt, is what we're really talking about,
Yeah.
because our heart works off of a potassium sodium pump. So, we don't want to mess that up too much because that impacts our heart in a whole different way that we don't want. But too much salt can increase our blood pressure, which means that, again, our blood vessels are getting weaker. The heart is working too hard. We're retaining fluid and making it even more difficult to manage all of that. And our kidneys help us manage that fluid. So if we're have a high blood pressure, that's going to impact our kidneys in addition to our heart. And then, we have to get on medications to help us really control that. And that's one of the things blood pressure medications does is help us remove that excess fluid. So fiber helps us to regulate appetite, decrease blood sugars, decrease cholesterol, manage our bowel habits. And then healthy fats help decrease inflammation, decrease certain types of cholesterol that have been previously labeled bad is the LDL cholesterol. And then in the past, the good cholesterol is actually HDL cholesterol. So all of these things sort of work together. And you mentioned there's so many ways that we can get salt, and you're absolutely right. So going back thousands, if not longer, years, we've used salt to preserve foods. And so when we look at something that we have on our shelf, keep in mind that they're making it shelf stable for as long as they possibly can, meaning there's probably a good amount of salt in that, and it's going to be labeled as sodium when you look at the back of the label. So making sure that we're watching for that and keeping in mind that we are getting it from places like fast food restaurants and packaged foods and even frozen foods and canned foods. We need to be more aware.
Yeah, absolutely. I remember the first time I ever looked on the back of a can, and I nearly sort of fell over, realizing how much sodium it takes to make that can of food last forever. Right. Like that, once that clicked, I thought, oh my goodness, I really got to watch that. Eh, for those of us who might feel, I don't know, let's say overwhelmed by the changes that we might feel we need to make, what's a good first step, Colleen?
If we can go to the next slide, I have some of these mapped out for us, but the very first thing again is start small. So
Mm,
something that you can do that doesn't feel overwhelming, and that might be something like adding a multivitamin every day, particularly if we're not getting a wide variety of foods. And another thing that people can do is change one meal in their week. So, maybe every Wednesday at lunchtime, I have more vegetables and protein. And that feels a lot more doable than I have to change every single meal and snack that I'm eating. Like, no,
yeah.
no, no, no. Let's start with something manageable. And then you feel comfortable with that, and that you realize I feel better and I have more energy in the afternoon if I have more veggies and protein at lunchtime. And then that starts to bleed into other meals throughout your week. And then really looking at what we can add rather than what we can take away. So anytime that we can add something like I can add more water, I can add more sleep, I can get up away from my desk more often, I can add protein, I can add vegetables, is a lot easier on our psyche than I have to get rid of or I can't have, right? Those are such negative connotations, and sometimes that makes us want those foods even more. So focus on what we can add. And
The
then
Oh, go ahead.
just, what can you do again that doesn't leave you feeling overwhelmed? Because we already feel so overwhelmed with many aspects of our life. Let's not complicate it further, but there
Yeah.
are things that we can do, little things to make those changes.
Colleen, I was just going to add too that you don't have to do this on your own. In our working team at Women Heart, we talk with each other about how we can support one another.
Yeah,
And I think that, like for me, that's how this also feels less overwhelming, right? Is there something that we can
yeah,
do to support each other? And thinking about the family unit, for example, or your neighborhood dog walking group or whatever, who who
yeah.
who can you build community with so that you can hold each other accountable or just support each other and encourage each other.
I love that. Yeah, exactly. Knowing that other people are having a similar experience to you and having that support makes a huge difference.
Yeah. Let's go to the next slide to talk about how do you help guide folks to make, you talked about sort of small steps initially, but what does sustainable long-term changes in nutrition look like versus these short-term, I don't know, let's say dramatic changes that really aren't going to stick around for very long?
Yeah, that's a great question. And oftentimes with my patients, I have them start with that awareness. And it's incredible that you ask, like, well, how much water do you drink? I don't even know if I do drink water. Let me think about that. Or tell me what you had to eat today so far. Um, well, I don't really remember.
Yeah.
I wasn't paying attention, right? So building that awareness of what we're doing from a nutrition standpoint, from a physical activity standpoint, sleep strength standpoint, all of those things. And then taking that and looking at, okay, this is what I'm doing. How can I take care of myself? Can I put my phone away 30 minutes earlier and get some more sleep? Can I turn Netflix off 30 minutes earlier? I know that's kind of, pressing it, right?
That's
Uh,
hard. Yeah.
But these are the things that we can look at of like, it's not giving up anything. It's just doing a little less of something to get more sleep and how I'm going to feel about that. The other thing that really helps with those long-term changes is looking for your motivation. So
Mm,
for a lot of my patients is being able to play with their kids or play with their grandkids. It might be taking less medication or just might be moving more easily in general. And so finding what that health goal is and what that motivation is helps you to make these other changes.
yeah. I think reframing is also really the name of the game, right? I was saying to a good friend, a heart sister actually, that I tend to ignore my Apple Watch when it says it's time to stand up. And
Uh-huh.
she said, Selena, you need to reframe that Apple Watch is your lifesaver. So it's, these really interesting like hacks almost to think about how
Yeah.
else you might frame some of these things that you're trying to change. So
Yeah.
thank you for that. I'm going to now bring in Rosie Harrison. As I mentioned, she's a Heart Sister, WomenHeart Champion, class of 2024, and she is joining us from Georgia. Rosie, you know firsthand what this experience is of managing heart disease, and having kind of these meaningful lifestyle changes that have sustained you sort of, in the long run to support your overall health, your heart health. And this focus on nutrition in particular has been a priority for you. While there are many different approaches to managing these conditions, in your experience, right, nutrition has been one of the most important tools that you've used. So thank you for being here. And I'd love for you to share with us a little bit about your story, what led to your heart disease diagnosis, and what other challenges around your health are you also facing?
Sure. Thank you so much for having me. I am so glad to see my heart sisters, and I kept nodding my head the entire time because there's so many things that women in general we benefit from, but especially as heart survivors. So I was diagnosed when I was younger with mitral valve prolapse, and as I aged out, the diagnosing criteria changed. But in 2020, I got COVID.
Wow.
And in 2020, I was one of those individuals that didn't quite fully understand when the CDC kept saying that individuals that had comorbidities like high blood pressure, overweight, diabetes, how that would impact my health if I had the virus, if I came down with it, until I had it. So in 2020, it came down hard. I was one of those individuals that ended up losing lung function. I never regained my taste,
Wow.
and I was diabetic at the time. I had fatty liver. I also had I never had high blood pressure, but I kept having those arrhythmias and that heart flutter that we all know so much. And I had a really hard time coming up and getting better because I just did not know any better and I did not listen, and the information that was made available to me didn't seem representational. And there was also a lot of stigma placed on cultural bias. So I had dismissed a lot of my fatigue. I had dismissed a lot of my shortness of breath. I had dismissed a lot of my chest discomfort. And throughout time, as time got worse after COVID, I learned that I wasn't supposed to be feeling tired. I wasn't supposed to have the headache all the time. I did not understand the difference between being insulin resistant and diabetic, and they're not one and the same. There's a lack of information for us. And then also specifically with CKM, there's such a comorbidity and there's such a connection between cardiac health, kidney health, and metabolic health. Because when we think about how we process insulin, right, that's metabolic. When we think about our kidneys and the way that our kidneys are affected when we are diabetic, and then the weight, how that affects our heart. Well, I was 286 pounds, and that's not healthy for me. I'm 5'4". I really did not understand how much my diet and how all of these different things affected my body until I had my first real cardiac episode in 2022, where I was told that it was my weight and I had anxiety and I just needed to do a better job at managing that. But I didn't have the tools, I didn't have the information, I didn't have the resources. So I really made it a point to learn what is manageable for me, because restriction is not manageable for me. I like sweets, but what I needed to really learn was mindful eating. I also needed to understand how my own trauma, my own mental health really affected with my relationship with food, and also how I viewed my need to be everything to everyone.
Yeah. Yeah.
And I think it's important as women that we recognize that we cannot pour from an empty cup. And we just do such a great job at doing that we think we can continue doing it and doing it and doing it. But realistically, you can't squeeze blood from a turnip.
Yeah.
So understanding that I needed to get my mind straight, I needed to get my heart straight, started going through therapy, really understanding that my cultural foods are okay, having a better education in portion control, attending a support group for individuals that I could be very honest and say, I had a horrible day today, and the first thing that I wanted was that Rice Krispie treat. Because I ended up developing a relationship with food to deal with my mental health or my emotional well-being, which led away from it.
Yeah.
And I think overall, my understanding of it's okay for me to have a Rice Krispie, a portion of it, but I need to pair that with something else. I do not demonize food. As a society, we do such a great job at demonizing food, especially ethnic food, just because it's different. But in reality, when we think about how we eat and the relationship, the cultural atonement that we have to that, it's so important for me to bring that in. So what I ended up doing was developing a strong support system. I would contact a friend. I have friends now where if I don't feel like I have the motivation, it's I have my FaceTime and I'll reach out to one of my friends, say, hey, do you want to do Pilates together? And we will exercise on FaceTime.
Awesome. I love
When it
that.
comes to food, really understanding the importance of chewing. It is so important for us to learn that our brain really grabs that signal of when you're full by the time that you're chewing. So understanding that I was able to lose 126 pounds. I'm
Amazing.
fortunate to say that I've been able to maintain the weight and I am no longer considered diabetic.
Wow.
Because my
Amazing, Rosie.
and it's doable, but it's an ongoing lifestyle change.
Yeah.
The fads did not work. I had a doctor that prescribed phentermine, and that was not a thing for me. It was also important for me to recognize my ADHD.
Mm.
In recognizing how my own mental health and recognizing the fact that I do have a diagnosis of ADHD and anxiety, so I am more likely to develop a way of making myself feel better with food. So instead, I ended up having to learn coping skills.
Mm-hmm. Mm-hmm.
As I really delved into my health, I learned so much more about how we can be fully inclusive. And when I have meals with friends, it's so much important to me to put the fork down in between bites.
Mm-hmm.
Just those simple things, because otherwise I'm shoving my face in. And I love a good sweet, but I can pair that with something else. Same thing with a great example would be tortilla chips. Definitely understanding that when I make those myself, I will make a big batch so that I can eat it throughout the week. And I was also a lot more careful with using seasonings.
Mm-hmm.
We can always include more seasonings and more spices to make things more flavorful, but also being mindful that a lot of the prepackaged seasoning has very high sodium.
That's right.
And that is something that I did not realize. So I just ended up making my own.
Wow, that's cool.
Um, I cannot stress enough just how much I am thankful that I changed my view on what food is.
Yeah.
I love food. I love the relationship that I have with food, and I have the connection of getting together with friends and family over food,
Yeah.
and really changing the connotation of that from I'm upset, so I'm gonna go eat something versus I'm happy, I'm gonna eat, and then I'm full.
Yeah.
It's okay to be
Right.
full.
Recognizing that fullness as a signal to your body. Rosie, let me ask you a question. How did you come to understand the role that nutrition plays sort of in all of the different health challenges that you are facing?
Um, Honestly, when I learned more about what diabetes was
Okay.
and understanding how diabetes affected my heart health, and now definitely when I had the honor of going to Minnesota for the Women's Heart Symposium, that really made such a huge difference to me. And even now, and in all of my post care, they were able to diagnose me with COVID, post COVID syndrome, and realize that I had the valve issues and the heart issues. And knowing how to maintain that was kale is not for everybody. There are plenty other superfoods that we can have
Absolutely.
that are absolutely healthy. Bok choy, amazing. I'm a soup
Totally.
person. If you know
Yeah.
me, I am a soup person. So
Yeah.
really knowing how to enjoy the food that I like and having it prepped in the fridge so that when I'm hungry, I can have what I want to have. And
Yeah.
also really listening to other people's experiences.
On to that end, sort of what have you found for yourself to have the biggest impact? So what was the change that you made in your diet or your lifestyle or how like your approach to this long-term sustainable lifestyle changes that you would say has made the biggest impact in improving your health overall?
Body movement is exercise. It doesn't mean you have to be at the gym.
Yeah.
So I garden. You do a lot of physical exercise when you're gardening. You don't
Yeah.
realize it until the next day. And then finding things to move your body or move my body that are fun for me, whether that's Zumba at home on a YouTube, that's Pilates at home on YouTube. And then really, I'm going to be very blunt and very transparent about it, recognizing that I did not know portion control. So switching from a big dinner plate to a smaller dinner plate.
Yeah. Yeah.
Realizing that the mindset where I was growing up is you have to finish everything in front of you. Well, if I have a smaller size, then I can finish everything I have in front of me without feeling like I need to overeat.
It is a hard thing to get let go of when you grow up with that mindset. I can still hear my mom at the dinner table, right?
Mhm.
So it's really about reframing it, like you said, and finding that right balance between, right, like the right size plate, but also just your own awareness. One of the things that I really try to pay attention to is before I eat a meal, I ask myself, am I hungry?
Mhm.
Just that question, right? Because so often we eat because it's time to eat, not
Mhm.
because we're particularly hungry. So that's an interesting kind of reframe for me. Um, Rosie, what advice would you give to other women who may find themselves in a position similar to you when you started off this journey? They want to manage their health better. They want to manage their heart disease or their heart health. They might be seeing that they're going down the road of, the CKM syndrome. What kinds of words of wisdom can you impart on them?
Listen to your body and advocate for yourself. Not every doctor is equipped to listen. They should, but they all don't. And it's okay to dump a doctor to find someone that is going to listen to you. The other thing that I would say is even if it's one thing that you change, if it just stick to it's a even if it looks like a small thing, for me, the thing that I struggle the hardest is drinking water.
Mm,
Drinking water is something that I have a very hard time with. It's a texture issue, it's a taste issue, and giving yourself grace and it really does bring it back to the basics of I need to drink 4 cups of water, well, the amount or 4 water bottles. To me, that already puts the ADHD going of that's a lot. But if I
uh-huh.
break the water down into small pints, oh, you can't really see it, but small pints water bottles, I can drink that and I'll drink on that all day.
Oh, wow.
You can do it. It's okay. Find a friend. And
Yeah.
it's important to recognize that you can have what you want in moderation and if you pair it with something else.
Yeah, absolutely. I like one of the things that I love. I have a friend who's Swedish and lives in Sweden, and one of the things that the Swedes do is Saturday is treat day. So, like you said, like, being completely what's the word? Restrictive doesn't work for most people. But if you say, Saturday is the day that we're going to have treats, like, I don't know, like imagine a whole country, right, saying Saturday is treat day. It's just an interesting notion, right? How we think about giving ourselves grace, but also giving ourselves some structure around that. Um, Rosie, I'm so grateful to you for sharing your story, sharing your journey, being so open. I'm really blown away by how open you've been in this conversation and sharing some of the challenges that you face, whether it's nutrition or otherwise. I'm especially appreciative of your conversations around mental health. I think we need to talk about that even more. The interplay between our physical health and our mental health is so key, especially around lifestyle challenges or opportunities, I'm going to say, to improve some lifestyle behaviors. I want to go back to Colleen. If we can go back to the slides. Colleen, you just heard Rosie, our champion story, really highlighting the importance of thinking about the person in front of you, personalizing the approach, considering the individual needs. Rosie talked a lot about culture and how culture shows up, right? In the way we think about our food and the way we think about how much we eat, whether we eat everything on our plate or not. So before we go to audience questions, and I see a ton of them, so I'm excited to go there. But before we go there, Colleen, do you have any final thoughts that you want to share on how women can take control of their cardio, kidney, metabolic health, with this lens of like giving yourself grace, taking it small, starting small, but also giving, like, leaning into who you are. I think that's what I heard too from coming from Rosie. Like, these are the things
Yeah.
that make up who I am. I don't want to let those things go. But I can still can still love those things and be healthy at the same time.
Yeah, definitely. And I'll say, Rosie, my goodness, how impressive. You have done a lot of work and taken a lot of steps that can be really hard to take. And so I think let's not glaze over the fact that you've put in a lot of effort and made a lot of changes and feel better because of that, right? Your mental health and physical health. So congratulations. And I think you brought up an excellent point about food and the relationship with food. So if we go think back to the very first slide about National Nutrition Month, I don't know if anybody caught that the theme this year was food connects us. And I think that's really important that we embrace that and remember that. So food connects us to our health and well-being, to our families and our friends, to our cultures and heritage. And we can feel connected through food to our environment and how we get our food and how we prepare it. And all of that's influenced by our culture and our families and the way that we live. And I think that also recognizing that we can misuse food as and part of that relationship with food can be distorted, but that there are things that connects us to memories and acts of love. So keeping in mind that food is not love, but the act of having it prepared for you or preparing it for someone is an act of love and celebration, and that those are ways that we do have connections with food. And so thank you for bringing that up so much, Rosie. That was perfect. And then just knowing that, again, progress, not perfection, and you can do it. And there are resources. WomenHeart has a ton of resources on their website, for example, but other community hospitals might have support groups, and there's definitely ways to find friends might be interested. They might not even, know that you want to know more about and work on heart health. And so finding a buddy that can help you make some changes, whether that's moving your body or drinking more water. So I think knowing that you're not alone is huge, and being able to advocate for yourself is also really, really important.
Thank you, Colleen, for that. I see we've got a ton of questions, so I'm just going to race through them, and we can just. I'm just going to say let's keep our answers short and sweet. The first one is an interesting question. Can someone reverse out of CKM syndrome? How do you know if you don't have it, since CKM syndrome includes so many different symptoms? And then could medication actually correct these issues or mask them? So lots of different pieces of that question.
Okay. So yes, you can reverse it. You might not be able to go back to stage 0, which means that there's no symptoms of CKM, but you can definitely come back from, an edge, right? Like of poor function and things like that, and feel better, improve your health. Yes, you absolutely can. Medications may be a part of that. And oftentimes the first thing that we want to look at is whether there's excess adipose tissue, excess fat that we can work on. Remembering it's not about the weight, it's about the health, but the weight can inform things like inflammation and how our body is metabolizing things. And our metabolism also informs our weight. So those things can all work together. The middle question, I got the medication.
How do you know you don't have it if
Ah,
there's so many different symptoms connected to it?
Fantastic question, because this is all part of the screening process that should be a part of our preventative care. And so we're watching things like fasting blood sugars and fasting insulin, cholesterol, blood pressure. That's how we know, is that we're monitoring those things with our provider.
So it's really about trends over time, right? It's
Yeah,
not just about the single day of the battery of tests that you might run, but the
yeah,
trend over time is really what you're looking for, and you want those to go in the positive direction. And if it's not, then that's the concern. But if it is, you're on a good track.
exactly.
Great. Another question here is there a level of salt that's okay? There's a recommendation. This says, my cardiologist recommended 15 grams of saturated fat per day, getting to an LDL of 55. Does it apply to everyone or just individuals? And what level of salt is okay? I'm going to add another question. I'm going to couple this with another question. Can your sodium be in normal limits, but could it still be hurting your arteries?
So excellent questions. And yes, it does depend on the individual. So the way that my body handles salt is going to be different from the way that yours does, Celina, for example. And so we might tolerate different levels. The general recommendation is to get under 2,300 milligrams of sodium. And so when you look at a label and it says that a tablespoon of a seasoning has 900 milligrams of sodium, we might want to rethink that one, right? So because we start looking at how that really fits in. So some people are going to have a lower sodium goal because they're just not responding to an initial decrease in sodium overall. And I think that's super important. The saturated fat and the LDL goals are also very individualized. Some cardiologists have hard numbers that they stick with and they want everybody under that. Others have a little bit more flexibility, but definitely paying close attention to when they throw out numbers, asking that question, like, is this just kind of across the board, or like how close can I get to that and it still be healthier for me?
In my experience too, if you already have a heart issue, or if you already have, like in my case, a high LP little a, then my cardiologist anyway is a lot more aggressive, right, in getting that LDL number down.
Yeah.
So I think that's another place that it might be tailored to an individual. We have come to 2 o'clock. You know what? Colleen and I said this at the very beginning. We can sit here for hours and hours and hours talking about this. There's so much to unpack. I really want to thank Colleen for all of her insight and her expertise in this. And thank you so much to Rosie for sharing her story so generously with us. Look, this is an issue that we all, I don't want to say struggle with, but are facing every day at every mealtime, every time we step in our kitchen, every time we open that fridge. And it's something that I love the picture I have in my head from you, Colleen, incrementally can make change, right? It's incrementalism is the way we're going to get there, not throwing everything out and starting over. We will continue this conversation over the next few months. We will dive deeper into these interconnected conditions: heart disease, diabetes, kidney disease, obesity. And we will be providing resources to help women navigate their care and management. We know that living with and managing chronic conditions like heart disease, like kidney disease, like obesity can be really challenging, which is why we're here and committed to offering education and support to enable you, to empower you to make choices for yourself. Our next webinar is on April 16th. And that is going to be a time where we're going to take a closer look at how these conditions are linked from a medical perspective. Dr. Pale is going to help us to do that, and we're going to be releasing resources throughout this year to support you all as champions, to support women in the community, not just to help themselves, but to help each other, and to look at how heart disease, diabetes, kidney disease, obesity, and all other chronic conditions that we're dealing with can be managed and managed successfully. So please stay tuned. Please go to our website, womenheart.org, sign up for our emails, and just look out for all of the different events and information education sessions that we're going to have. Thank you once again. I'm so honored to have gotten to spend this hour with the two of you. Man, we did it again, guys. This is, sometimes I think we can't possibly top the last one, but we did it this time. So thank you both.
Thanks for having me.
Thank you, everyone. Have a great day.